Together we achieve victory over heart failure.
Hello and welcome. I am Dr. Amit Bhushan Sharma, Director, Unit Head Cardiology, Paras Hospitals, Gurgaon. Today we are delving into a silent epidemic that India is combating, which is heart failure. In India, the majority of patients grappling with heart failure are surprisingly young individuals. It's a common occurrence to witness a young adult seeking medical assistance for heart failure, unlike in the Western country where the heart failure is predominantly a disease of the elder population. Let us break down heart failure into 5 essential insights. What does it mean, firstly, when a doctor tells you that you have heart failure? Majority of the people, when the doctor diagnoses with heart failure, they think it's the end of their lives. The term of heart failure can be frightening, but it simply means that your heart muscle functioning has reduced to less than 35%. Normal heart functioning is between 55 to 70%. Secondly, why are so many Indians affected by heart failure? So they have got multiple factors. It could be because of blockages, heart attacks occurring at a young age. When you have blockage resulting in a heart attack, which is not treated in time, can result in a heart failure. Other factors like hypertension, diabetes, obesity, smoking, loneliness, stress, lack of sleep, they worsen this epidemic. What are the signs and symptoms of heart failure? So when a patient has heart failure, 3 things happen. One is what the patient sees, one is what the doctor sees, third is what nobody sees. Patient sees is classical shortness of breath while lying down. The moment you sit up, the shortness of breath decreases. Or classical coughing while lying down, associated with swelling in the abdomen, swelling in the legs. Second thing is multi-organ failure. Multi-organ failure essentially means that the heart is failing as a pump. Let's say if the heart functioning is 25%. So blood is not going forwards. All the organs in the body are receiving only 25% of the blood flow. Normally brain, which should receive 1 liter, is receiving only 25%. That means only 250 ml. Kidney, which should receive 2 liters, is receiving only 25%, which is only 500 ml. So it results in multi-organ failure. Third thing is what nobody sees is the risk of sudden cardiac death. You must have seen or heard about people getting cardiac arrest during sleep, during exercise. It happens to those people whose heart functioning is less than 35%. So this sudden cardiac death is worse than end-stage cancers. And if you have a congestive heart failure, which is untreated, the mortality is worse than end-stage cancers. Only thing is, time is muscle. If you know, then this is treatable. Third thing is, how can we protect ourselves from this disease? The 5 golden rules to follow. Early detection of heart failure by doing an echocardiography and ECG. Second, like you have a bank KYC, same way, know your numbers. Knowing your pulse, blood pressure, fasting blood sugar, and walking distance. These 4 numbers, if you are there, 90% chances of heart failure is circumvented. Third thing is dietary adjustments to maintain heart health, incorporating your daily exercises, practicing stress management techniques, quitting alcohol, tobacco, and smoking. Fourth thing is what happens if you've had a heart failure. How do you treat it? Treatment can be either non-medical management, which the patient has to do along with his relatives. It's a team approach. Second, medical, and third is the surgical options. Non-medical management, now salt and water are your major enemies. That means fluid restriction to less than 1.5 liters a day, including all liquids. And salt to be restricted, no added salt in the diet. The less salt, the better it is. Second thing is there is something called as daily monitoring and something called as weekly monitoring. So daily monitoring, as I told you, of your pulse, normal pulse rate should be 60 to 70. Blood pressure, normal blood pressure is 120 by 80. But if somebody is in heart failure, his normal blood pressure is 100 by 70. So if the blood pressure is going beyond 100 by 70, that means that this patient is going into fluid overload. Third thing is knowing your saturation. And fourth thing is knowing your fasting blood sugars. Weekly monitoring of two things is important in heart failure. Number one, knowing your weight every weekly. And second is measuring your urine output every Sunday from morning 7 o'clock to next morning 7 o'clock. Ideal urine output should be more than 2 liters. If the urine output is less than 1.5 liters in a urine measuring pot, then you should consult your physician. Second comes the medical therapies which are there. And third comes after medical therapy, then third comes devices like ICD. ICD is implantable cardiac defibrillator. Cardiac defibrillator, you must have seen people getting shocked in the movies. So that is called as a cardiac defibrillator. Obviously, you cannot have it at home. So then you have a matchbox-like device which is implanted below the collarbone, which is called as ICD, which has got two wires. Then certain indications you put CRTD, which has got three wires. So this CRTD helps to improve the heart functioning. If there's a dangerous rhythm coming from the bottom chamber of the heart, it shocks you and saves your life. It also works as a pacemaker if the heart rate goes down, and it improves your symptoms and shortness of breath and heart functioning to a large extent. Lifetime risk of congestive heart failure is 1 in 5 for both men and women. If they are not treated in time, you can result in therapies like LVAD or cardiac transplants. And eventually, if you are not controlled, risk of sudden cardiac death is real in such patients. So make sure that compliance to medicines, compliance to the lifestyles, knowing your four vital numbers of pulse, blood pressure, fasting blood sugar, and walking distance, and knowing your weekly targets of weight and urine output is paramount in such cases. Thank you.